Hello, I'm Amberlyn Carroll. Thank you for joining me on Medwatch today. Community health system not only encourages employees to grow in their professional roles, but provides resources to fuel career advancements from within. Candy Zaranyika has been on her community journey since 2000. From working in the OR as an extern to now managing labor and delivery at Clovis Community. Candy says she's utilized community health system resources to grow in her career.
What I've learned from my experience here is that I can see growth potential in other employees. Also for me, I didn't even think I'd be a manager, to be honest. The director encouraged me to apply.
We encourage our team members to apply to jobs that are available that will give them the opportunity to either promote and or transfer to gain different experiences, because collectively that will contribute to the ongoing success of our team members.
Carla Milton is Senior Vice President of Human Resources with Community Health System and says opportunities for nurses are tremendous at this time.
With our hospitals and post-acute services, with our health plan, but also with our provider network and the clinics. Whether or not the opportunities at the bedside or in one of our clinics or in our quality and risk management division or education or informatics, there's just a wealth of opportunities. If you choose to have your entire career at community, you can certainly do that because of the just vast amount of opportunity at this organization.
Candy Zaranyika briefly left community to be closer to her family, but knew she wanted to come back.
Oh, well, because the people here are fabulous.
Employees who are engaged or emotionally connected to an organization don't leave the organization. A couple of years ago, we implemented a tool that we call Community, where we're able to ensure that we get messages to our team members. They can subscribe to different channels that are most relevant to them so they can stay connected to the topics that are most important to them.
Being able to grow within community's walls, Candy says she pays it forward every day.
It helps me to have compassion, some empathy. Sometimes also, if it's busy and there is a room that needs to be turned over for a patient, I can get in there and help clean. I know that every single role is important.
I think Candy is the example of what we strive to provide. We want the opportunity to be for a lifetime.
Community Health Systems stands as a fellowship, growing together and fueling a workforce for one common goal.
It's about living our mission. So I think that's the number one thing that we can do to drive employee engagement, is to live our mission in providing the best care that we can for our patients.
There were days that were tough, and I still remember one day it was hard. There was a lot going on, a lot of cases back to back. And I asked one of my friends, I said, how do we do this? He goes, you just do it. And so I said, okay. So I just did it. And that's what I've been just doing it ever since then.